All right, real talk for a second. If you're a physical therapist or running a clinic, you already wear like 50 hats a day. Clinician, manager, scheduler, part-time tech support. I see you. But what if you had a sidekick that could help you do all of that? Something smarter. That's where Empower EMR by MW Therapy comes in. It's built just for physical therapists, and it's loaded with smart automations and AI that help you grow your practice without burning out. No more chasing paper trails or fighting outdated systems. This thing handles billing, scheduling, documentation, patient engagement, all in one clean, customizable platform. The best part? It's actually affordable and scales as you grow. Clinics everywhere are loving it, and if you're ready to take the stress off your plate and be the hero of your practice again, check out a free demo at mwtherapy.com.
We talked a little bit about the screening piece leading up to it, and I think that's one of the most important pieces, right? Is like trying to prevent something prior to it becoming an issue. So there's a ton of medical screening leading up to flight. There's a ton of preparation. We want to make sure people are launching, fully ready to go. So that's number one. That's key. And then if something does happen in flight, this doesn't happen incredibly often. I think Corey can talk a lot about the strength and conditioning side and how vital that is to preventing injuries. But if something does happen in flight, you're right, it's full on telemedicine.
Before she was helping to optimize human performance in zero gravity, she was boots on the ground as an active duty physical therapist. Her daily mission? Well, supporting some of the most elite humans on and off the planet. She's passionate about operational physical therapy, advancing health for astronauts, and making sure we don't just survive space flight, they thrive through it. From Johnson Space Center straight into the Pintcast airlock, say hello to Danielle Anderson, physical therapist, and strength and conditioning specialist, Corey Twine, here on Pintcast. But let's start with you. Danielle, what is your superhero backstory? Corey, I'm going to ask you the same question in a couple seconds to just give context to who you are and then what you get to do with who, where. That because this is I'm very excited. I don't know if you could tell for this conversation.
Yeah, no, that's awesome. Thanks for having us today. I don't know that I would put myself in the superhero category, but I do. I love what I do. I'm an Air Force physical therapist. I've been in the Air Force for 13 years. Had the opportunity to deploy a couple times, supported large-scale military treatment facilities, and then ended up here at NASA about almost 4 years ago now, supporting the Astronaut Corps and working with awesome people in the human performance team like Corey.
Well, thanks for your service. Corey, what do you get to do?
Yeah, the same. I'm thankful for the opportunity to be here. Thankful also to be on this podcast. So I'm a strength and conditioning coach by trade. I came up through the collegiate realm back in the early 2000s, and then NASA was my first job. So I was here for about 5 years doing the shuttle program. Then I left, went back to college football, did a military DOD, stayed for about 3 years, and then I recently came back about 4 years ago.
Now, this is not on the question list, so I'm sure the public relations person is like, wait, he's already going off script. But Corey, be honest. When you put NASA on a resume, you're getting that job, right? I mean, any job that you're going for. When you go back to college football, they're like, I guess, astronaut, we got right?
I can't say that's the case. Sometimes, though, I think people, though, which makes sense, sometimes like to hire specifically those that are doing what they're hiring for. So, in collegiate athletics, what I learned is the biggest question is, are you going to be able to handle this work volume? Versus assuming that's the case. So, yeah, it does help, though. I'm thankful for that opportunity.
All right. So we'll ask this question to both of you. You pick who answers first. But what's it really like to be a physical therapist? What's it really like to be a strength and conditioning specialist in space flight support? I mean, this is 9-year-old Jimmy, and this is going to date how old I am, and maybe the audience will catch on. I watched, Space Camp as a kid and was hoped that I'd accidentally get launched into space at some point. But what's it really like? Because the audience probably is going to make a bunch of assumptions about what you actually do and what you support. So let's bust those myths and get to the real answer. What is it you guys get to do there?
Yeah, I think for me, coming from that operational background, it's an opportunity that you get to support a huge, robust mission, complex mission set, right? And it's not just, I go to work every day and I see patient care, but I see patients because those patients are hopefully going to the International Space Station or training for an Artemis mission. So to be able to kind of see yourself and how you fit into that big team, and not just your healthcare team, but your team of human performance specialists and engineers and all the trainers and everybody that's getting these astronauts ready to go to space. I think it's literally living out a childhood dream. Like you mentioned, like we all grow up seeing astronauts and seeing about space. And it's truly, it's an awesome opportunity.
Yeah. Corey, same thing. Like, what are some things that maybe you do that someone like me wouldn't even understand, like wouldn't even think of?
Yeah, I would say for me, one of the things that hit me always is the big burden that comes with it. So when we have astronauts are working with them, they're trusting us to be a resource for them while they're off the planet. They're not just over here, over there. They're 400K away. Yeah. And they're trusting us to help them stay healthy while they're off the planet. And that's a big responsibility. Though, as Dr. Anderson mentioned, though, there's a big team, and even for me, how I contribute to that team, I'm just like the grease on a spoke of a big wheel that spins, but still just thinking about that aspect. And then there are some aspects of being in human performance for a while, but here, which is unique, working in football, working with other athletic settings, I've never had to worry about bone and bone metabolism or maintaining bone health, particularly in flight, is a very interesting task. It's different, it's multifactorial. There's a lot that goes in there, and, trying to figure out how to better combat that from a countermeasure standpoint to, again, to provide better resources for the astronauts while they do those things are very important. So in a sense, it's almost like feeling like puzzled sometimes, Sure. Where you think you're like trying to figure out, okay, we know what to do for strength. We know what to do for cardiovascular, cardiorespiratory fitness in general. That's helpful. Not necessarily always in space flight, but, bone can sometimes be the big question mark on how best to combat that.
Yeah, because gravity, you got a little bit of it, not a whole lot of it in space. So we've heard about muscle and cardiovascular deconditioning in space, but feel free to, this is where we get to be geeky, right? This is where trust me, you're not going to go too geeky for our audience. They're just going to they'll eat this stuff up. Start from the basics. What does happen to bone and the spine and the body in space that maybe PTs, I know that I don't remember the stat, but we get shorter, right? Because less gravity, we're going to get shorter. But what else happens, and what else surprised you the most when you started to learn about it? And like Corey said, treating it like a puzzle. Now that I know this, I have to figure out how to prevent that or solve that.
Yeah. I'll talk a little bit more about the bone and spine side of things. I think something that's super common in astronauts or anybody really that gets into microgravity is a lot of people experience something called space adaptation back pain. We don't know exactly the pinpoint reason for it, but we do know that the spine elongates and people tend to get a little bit taller in flight, even up to 2 inches taller. And so a lot of people will experience this for the first several days in flight. It's typically not duty limiting. It doesn't require a lot of interventions, but things like over-the-counter medications and stretching can be helpful. But then there's also this period of a long-term impact to the spine specifically, where we see that when astronauts come home, they typically have some alterations in their deep spinal stabilizers from a muscular standpoint. Some cases will have people come back with decreased cross-sectional area of their multifidus. Some may have fatty infiltration, looking kind of similar to whiplash style patients or patients that have bed rest. We see those really similar impacts. And then that also, not just from a muscle morphology perspective, but it also does increase their risk of having symptomatic back pain in that first year, even that first couple weeks leading up to the first year post-flight.
And then that even off of planet Earth, we still sort of don't really know where back pain comes from. We're it just does. And right. I did say astronauts get shorter, but I flipped that 180 degrees. They get taller in space.
They get taller, exactly. But when they come home, they go back to normal. But yeah, I think that just brings to the complex nature of back pain, right? Is it's so complex on Earth, and then you add in that microgravity of trying to understand what's happening. It's definitely, as Corey mentioned, one of those multiple puzzles that you're trying to put together when people have those symptoms.
So hold on a second, Danielle, you're talking about difference in measurements on really small things, which means that you're measuring baseline of very, very small things. Did you say intercostal space or length of multifidi? These are small things. You're measuring all these things before and after, obviously, I'm assuming?
Yeah, that's a great question. And something that we do a lot of medical screening on our astronauts, both prior to them getting selected into the astronaut corps, and then again, prior to them launching. Once their mission is signed, they go through a whole nother host of medical screening. Some of the measures that I'm talking about are more on the research side. There's kind of those two different buckets of what makes you operationally ready, and then research is also going to look at things in a much different capacity. So we do have a lot of research studies that have looked really closely, like ultrasound testing, even in-flight ultrasound testing, coming home, looking at inner segmental space, looking at MRI, muscle morphology. So really into the weeds on what's happening, which is really cool.
Now, Corey, are you doing something similar? I mean, we're all really familiar with like the combine for the NFL. Is there something similar that you're doing in terms of measuring before and after? I mean, because like you said, these astronauts are also probably, it sounds like an experiment, right? You're measuring what's happening.
Yeah, we, especially for ISS missions, we do have a fitness assessment that we run them through. And the goal for that is to assess muscular strength. So the IMTP is a big aspect for us to understand lower body muscular strength. We also, as far as the isometric mid-thigh pull, we would like to get better at understanding the neuromuscular properties of producing that strength. So far as rate of force development, being able to do that efficiently too, to understand what happens to our ability to be able to recruit motor patterns and things like that. We also have when that part is pre and post, just to characterize the consequence of space flight, but there's also an aspect of that to go into readiness. As we know with IMTP or isometric mid-thigh pull, there are some relationships to dynamic tasks as far as squat and then other things as far as certain aspects of sprinting, certain segments of sprinting and so forth, where that type of information in a controlled environment can be useful. One of the things that I say that I think is critical for us is that too, when they come back from space flight, we also have to scope out or pick tests that they can do at that early stage of reconditioning. So when we get them here, we say R plus a return plus 7 days. So 5 to 7 days after they get back, they need to be able to do that test. And if it's a strength measure, we need to make sure all the other stuff that they are dealing with, even potentially orthostatic intolerance or something like that, won't put too much noise in our strength measures, so we can really understand if our in-flight countermeasures was efficient at preserving their muscular strength.
You've thought about this. For a second there, I heard the beeping. I thought we were about to take off. I thought you were gonna pull a space camp on me, and I was very upset that I wasn't there. What are some of the things that might surprise other things that might surprise physical therapists or strength and conditioning professionals about what these? I mean, I learned this term when I was a PT student. Tactical athletes, right? Like these are people who are going to do a lot of things that and then they're going to have to do some stuff on the fly because stuff happens, especially in space. To prepare them for all the things that happen, like, I don't know, maybe having to be in space for dozens of extra days when that wasn't predicted.
Yeah, so prior to, you can kind of scope out like what the mission set looks like. Prior to a launch, the crew are usually assigned anywhere from 18 to 24 months prior to going on a 6-month or even shorter or longer mission set. And through that time, they are going through a ton of training. So from our end, the training looks like getting them familiar with the exercise countermeasures. So Corey is a strength and conditioning coach, and we also have 3 athletic trainers in our group. They're really trying to get them comfortable on the ARED device, which is the Advanced Resisted Exercise device, the CVISH, which is the cycle that's in flight, and then the T2, which is the treadmill. And so their goal is to make sure they are fully confident and capable to be able to use those exercise equipment when they get in there.
Not a surprise that we're using a lot of acronyms with NASA, right?
I just know those.
Like, all right. So I didn't think about this until you mentioned a few things, but are you guys just the ultimate, once the astronauts are in space, are you the ultimate like telehealth providers? Because you can't be on site with the people that you're taking care of. So like, what's the big picture on how you're taking and managing injuries while they're already is off planet? Is that what you call, like, how do you reference where they're off planet? I don't know. How do you reference where they are? And what do you do? Like, how do you work on patients when they're not on the same planet? This is the first time I ever had to think about this.
Yeah, it's a great question. We talked a little bit about the screening piece leading up to it, and I think that's one of the most important pieces, right? Is like trying to prevent something prior to it coming an issue. So there's a ton of medical screening leading up to flight. There's a ton of preparation. We want to make sure people are launching, fully ready to go. So that's number one. That's key. And then if something does happen in flight, this doesn't happen incredibly often. I think Corey can talk a lot about the strength and conditioning side and how vital that is to preventing injuries. But if something does happen in flight, you're right, it's full on telemedicine, right? We have Teams capability. We do have a diagnostic ultrasound in flight to where we can guide another astronaut to do remote guided diagnostic ultrasound, which is vital to helping us understand the condition that they have. And then just a lot of ingenuity of, how if I wanted to do something on the cervical spine to mobilize, a certain region to help somebody's pain, how can we do that in flight? Is that going to be with another crew member? Is it going to be with potentially like a resistance band, something like that? But I think Corey's piece of the strength and conditioning and the programming that they do is so vital to the injury prevention side.
Yeah, Corey, what's exercise prescription look like while someone is already, on a mission off the planet? Like, are they, are you just, DMing them like the WOD, their workout of the day? Or what does it look like?
Sometimes, quick joke, I think one of the astronauts called my cell phone one time and it said U.S. government. And it kind of scared me. I didn't want to pick up, so I had to pick it up. And then it was one of the astronauts, and it was cool because we were able to have a conversation about their exercise. I will say one of the things that took me back from coming here and actually training ISS crew members, thing that is, I hear a lot of them now, it's almost like a joke. They say, well, I want to do what I'm going to do on the International Space Station. And my response is, no, you don't. And then they say, yes, I do, because just the sheer volume is crazy of what they can do and withstand. They actually do resistance training every day. Probably most of them about 6 days a week, but some of them will burn 7 days a week, about 2 hours of resistance training. And that's a volume or a magnitude that is not sustainable in 1G or back here. But it still carries with it a mechanical stress that we have to account for. So we still need that systematic variation in the volume and intensity that they're doing over time so they don't get any issues. Because even though they're recovering for 22 hours in space or floating, they're still having to deal with that A-red or being squished under that load and the A-red in that sandwich aspect. And the biggest asset that we have for remote human performance that I would call is education. So Our goal is to have astronauts to understand what our goals are for them and how we can help and assist them while they go do their mission. In addition, I would say this, which is very important, is proper integration. So when we're working with astronauts, when they're off the planet, there are certain aspects or things that come up that are in line with my skill set. And that's pretty limited. I'm just with the meathead, just come on, let's just lift weights. But then there are times when things start to fall out of my skill sets, and then we rotate who's running point on those situations to make sure that we do not dig any holes from a musculoskeletal health standpoint or for certain things like that. And when we do a good job of that, we don't really have any bad issues. We kind of stop stuff before they become real bad issues. And what happens is if there are issues that's important, because if you get an astronaut who can't load, it's a bigger consequence than in 1G than if they can't load, because now we're talking about a bigger consequence potentially with bone and muscle deconditioning when they're not able to exercise versus just with 1G.
Here's the truth. You do the work, you care for patients, you fight through schedules, documentation, and the chaos of healthcare. So why shouldn't you get paid on time? That's where Athelis RCM comes in. It's billing, but smarter, AI-powered, fully automated, and it integrates with your existing EMR. It handles everything from claims to denials and revenue reports. It's like hiring an entire billing department without hiring an entire billing department. And providers are raving about how much time they get back. Not to mention 15 to 20% boost in collections, not too shabby. So yeah, you can have fewer headaches and more money. Just book a demo at athelis.com. That's ATHELAS.com and see what your billing could look like when AI has your back. What are you able to monitor? I wear the Apple Watch, right? It tells me when I need to sleep more and yada, yada. What sort of data I mean, I've seen Apollo 13 too, right? When the guy rips off his biometrics and everybody's freaking out. What are you able to measure, and like what's important, or what are you looking at a lot?
Yeah, so right now what we're looking at to give us the understanding of internal load, what we're reliable is just heart rate. We have that. We are heavy on RPE, 1 to 10 scale, because the brain is an amazing piece that can give a big evaluation of the entire body and an understanding of everything that's going on and give that back into a good composite score of the RPE. So we love both of those. We also monitor the external load as far as when they're doing exercise, as far as the load they're using, in addition to the wattage if they're doing a cycle, or the speed and the load that they're being pulled down when they're running on the treadmill. And what we do is we put all of that into a bucket, and we make relationships with all those things. And then we look at them over time and see how those relationships are changing or staying the same to give an indication on their performance. And that's important. But there are some spin-ups of a lot of amazing scientists that we have here now that are looking at other ways to monitor, less invasive ways to monitor different things in the future, as far as HRV and even cortisol or things like that have been discussed. What most people don't realize is that, though, trying to monitor something like that in space is a very difficult task. It's not as easy as just me wearing a Garmin watch and then going driving down the car, because we actually have to get it up there, and it has to be a type of hardware that doesn't create vulnerability for the crew while they're wearing it while they're in space also.
Understood. Danielle, I think I cut you off there for a second because I got real excited to ask about what you can measure, but what were you going to say?
No, all I was going to say is I think what Corey said was vital about injuries, right? Like in 1G, we can tell somebody to go ahead and take 2 weeks off, right? Maybe do some light exercise, do some simple isometric stuff. Rest is usually a great tool in rehab. We don't have that tool in flight. It's really actually vital that we keep pressing because of those deconditioning impacts, bone impacts that Corey mentioned. So that's just key.
Now, when you mentioned countermeasures, this is not like a Air Force, Space Force term, right? Countermeasures is like a term you guys use. Like, what is it? What are you referring to? And how's NASA evolving countermeasures? What are they?
Yeah, so countermeasures is a NASA term. So NASA has a lot of different risks that are associated with spaceflight. We've talked a lot about the muscular risk, the bone risks, the MSK risks that are associated. And so with every identified risk, there is a goal to establish an effective countermeasure. So we've talked about the muscular deconditioning, cardiovascular deconditioning. So their countermeasures are the advanced resisted exercise device inside, which is kind of like a jackknife of all trades for bench press, squats, deadlifts. It has a ton of capabilities and can load up to 600 pounds. And then we have the cycle for cardiovascular deconditioning and the treadmill as well. I think Corey can speak to a lot about what they're looking at for future exploration.
Yeah, there's one thing that's interesting with what we currently have. We have a lot of space, and also the ARED, amazing device, is still mass and volume. So we hear that issue a lot. So mass and volume, is expensive to fly and to develop hardware that has, that mass and volume. So the future hardware is helpful if it's smaller, but still have those same capabilities, because we've learned from going from our IRED, another smaller resistive exercise device that did not have the capabilities of the ARED, the current advanced resistive device, is that it is easier to maintain crew health with the ARED. But again, we need that load. So there are a lot of things that are being looked at now as far as, digital load type systems or things like that, to where our motorized load, where we can have the same load or intensity with the smaller footprint to be able to put on the ship. But which is also very, I would say, difficult, is that usually everything that goes on the ship, the force that is created when you're exercising, that has to be absorbed, or else that force goes into the ship. Now, I'm not a loads and dynamics structural engineer. I do know that that's not bad for that's not advantageous for the ship and the trajectory that is on. It could be, as far as the solar arrays, like if you're working out, if their loads are they're flapping and things like that, it could create a lot of problems. So it could be very interesting. So we have all those constraints that we're are also trying to fit exercise in that envelope of understanding. And it's not an easy task. It's actually a very difficult task, but we have a lot of amazing engineers here being able to help us figure that out. And some of the things we deal with from exercise specialists is the constraints or the perimeter that the engineers paint on as far as exercise. Okay, well, when you're doing this modality, okay, these are your restrictions, this cadence, this beat or whatever, or something like this, or this load. And now we're back and we have that in our pocket and we're saying, okay, now how do I keep this particular individual fit with these restrictions?
Don't deadlift so hard you take the IFS off course is what you're doing.
Exactly.
I want you to set a PR, but don't knock us off course. So looking ahead to Artemis, first give some context to what Artemis is, but looking ahead to Artemis and beyond, what are some of the biggest human performance challenges that NASA is already thinking towards?
Yeah, great question. So Artemis is the mission that will put people back to the moon for the first time. So we have Artemis 2, where we already have a crew, and they're going to go around and circle the moon and come home. And then the next step will be to get foots back on the moon, ultimately to create an ecosystem that we can launch and go further into exploration onto Mars. From my perspective, I think Corey and I kind of bring both ends of the human performance spectrum, where I'm really focused on MSK injury prevention, primarily around the new spacesuit. So we're headed into a time where there's a ton unknown with the type of spacesuit, the mission set and duration, the tempo of the missions that we're going to be doing. It is completely different than what we do with the ISS training right now. So we're headed into just a lot of unknowns, which is also incredibly exciting. So our team is really focused on trying to get ahead of some of the injuries that we're anticipating with the spacesuit, because the spacesuit is a very unique environment that poses unique challenges to the MSK system. So that's where I'm kind of coming at it from the human performance perspective, is really trying to understand and characterize injuries in the spacesuit.
What's communication like when someone is on a mission? Are you sitting in the room we all know from Apollo 13? Because that person, the health person, was not treated well in Apollo 13. He kept trying to bother the astronauts to try to sleep, and they're like, we're not sleeping, right? Like, so what is actually going on? What is besides Corey getting straight up phone calls from space, what is that like when a mission is going on? What's your day like?
Yeah, great question. So we mission control is a 24/7 operations, 365 days out of the year. Within that team, all your mission critical personnel are going to be in mission control. And of that team, from 7 to 4 or 5 in the afternoon or evening is a flight surgeon. So a flight surgeon is typically on console during the normal operations of when crew are awake. If there's any like critical events like launches, landings, any spacewalks that are happening, there's always medical support in the form of a flight surgeon on mission control. Our team gets the opportunity to meet with our crew via Teams through private exercise conferences once a month. They can also call, as Corey mentioned, anytime that they want. And then we do a lot of email communications as well.
That's great. All right, so this is going to be like an off-topic question. See if we can put two things together. What lessons from spaceflight physical therapy, from spaceflight strength and conditioning, do you think that every healthcare provider, leader, business owner, anybody could steal? NASA was also famous with like checklists and making sure things were in order because we want to minimize risk. Like, so what are some lessons from the things that you do that you think are applicable to anybody in healthcare?
Can I take that?
Yeah. The lessons, I would say the biggest lessons is that it's a human business, whether we're any situation that I was in. And where I'm going with that is that it's not just sets and reps necessarily. So people respond to exercise differently. There's variability in how they respond. There's a variability in how they tolerate the stress of that exercise. So if we can get tunnel vision or fixed on our specific approach or our desire to do it a certain way and not respond to the human and end up in a place we don't want to be. So I think that's the biggest thing. And for us, it's more of a risk for that to happen, again, when they're off the planet. But that's probably one of the biggest things. Like even coming up from one mission to the other, and training a different astronaut. And I feel like, okay, I got this template. Here we go. And this is what we're doing. And next thing you know, that template's on his head. But we figure out these principles that are important. And, we put the same ingredients there. We just change it up a little bit, cook it a little longer, or do whatever to make it more suitable for the individual we're working with.
It's a little bit different when a physical therapist asks, so are you going on any trips anytime soon for a patient? Maybe a little bit different when you're asking your astronauts. Are you guys ready to play a game I like to call Ground Control Quickfire? Are you guys ready for that?
Yeah, I think so. Let's hear.
All right, here comes Ground Control Quickfire. You can each answer for these. I'm going to ask you 5. So just rapid fire, whatever comes to mind first. First thing you think of when someone says rehab in microgravity. What is it, Danielle? What's the first thing that comes to mind?
Say ingenuity or creativity. You got to be creative.
Corey, rehab in microgravity. What do you got?
Did I give you 2 high lows on back squat?
What's one human performance myth you'd love to just launch into space and get rid of and just completely abolish? What's the myth, Danielle?
Ooh, I'd say that when astronauts come home, that they can't walk, they can't function. Some of that is a little bit true from the sensory motor perspective. There are challenges vestibularly, but man, they come back in incredible shape and they are ready to hit the ground running when we see them, which is exciting.
Good. Corey, what's a myth you want to get rid of?
I think a myth is that exercise programming is easy, where it is initially, but over time, that's where skill comes in.
Yeah, and creativity is what I'm getting a theme here. Coolest technology you've seen or used in your career working with astronauts?
Mine would be ultrasound in flight, getting to be on the ground, telling an astronaut how to do a diagnostic ultrasound. Incredible.
That's wild. Corey, cool tech. What do you got?
Couldn't be any cooler than getting in a spacesuit a couple of times.
Oh, yeah.
Cool.
That's awesome. We got 2 more. What would surprise most PTs and strength and conditioning specialists about astronauts' physical preparation?
I would say that they are generally committed, but how busy their schedules get as they approach launch day. And that, it's pretty intense, the last, say, 60 days or 30 days outside of a launch, how busy they are, but they're still committed in what they do to try to maintain their fitness during that time.
Love it. All right. Last one.
I think that's we want to be pushing exercise, right? Like that's what we want, but we also respect everything that they have to do leading up to flight.
Yeah, understood. And last one we'll do, what's one leadership or mindset tool that helps each of you think long-term that you get to apply in your work?
I think for me, like the vision is the key, right? Being able to effectively communicate the vision, keep people motivated on the vision, and having a common goal to execute that. It is so vital to make sure that a vision is well understood within the team. Corey, what do you got?
Yeah, I would say vision too. And the vision is that the responsibility and the burden we have to serve this community in a way of human performance, I think is this like the cornerstone that I have.
Perfect. Yeah. And some of the biggest innovations usually come out of the military or NASA. I mean, you guys have found all these latent problems and then solved them. And lots of us have benefited from those things.
Yeah. Yep. We do have CEUs for physical therapists, NSCA, and then also BOC for athletic trainers as well.
Perfect. All right. We'll drop the link in the show notes if anybody wants to tag along and check out Shop. Thanks for doing what you do. Thanks for sharing it, not just in this podcast, but for things like Shop and just letting us see that team sport, live on and off the planet. We appreciate it.
Awesome. Thank you.
Thank you.
You ever wonder how those rock star clinicians seem to just know what to do? Like they've got a sixth sense in clinic. Well, here's the secret. Brooks IHL. Their residency and fellowship programs for PTs, OTs, and SLPs are where clinical skills meet elite mentorship. We're talking 150 hours of one-on-one mentoring, lab training that's immersive, and real-world experience inside Brooks Rehabilitation's top-tier system of care. And unlike some programs where you have to put your career on pause, Brooks IHL pays you a full salary while you level up. Their grads consistently outperform national board pass rates, and most of their mentors, they've been through the program themselves. If you're serious about being a clinical expert, this is the move. Go to brooksihl.org and check out all 10 program tracks. The next level of your career is waiting at Brooks.